Anatomy students, you've made it. This is video 25, our final video of the quarter. Video 25 is review for the final exam. So I am going to try to cruise through this efficiently. Pause all you need if things are going too fast, but I just kind of want to give you a rundown on what to expect for the final exam, but also sort of a really brief overview of everything we've done this quarter. So it's amazing, so you should take a minute to take a deep breath and appreciate everything you've learned this quarter, because it's a ton. Okay, so for the final exam, be prepared to label any and every bone of the body. On things like final exams and board exams and comp exams, they like to use questions like how many bones make up blah blah, or how many bones are in this part of the body, because that's a quick, easy way to ask a question to know whether you know all the bones, all the bones in a certain part of the body. So we're going to start with bones here in our review and go through each part of the body briefly and talk about the bones there and how many there are in each part. So first of all, recall one of the first things we talked about was the two different parts of the skeleton, that the skeleton is divided into the axial skeleton and the appendicular skeleton. So the axial skeleton is all of these bones of the head plus all of these bones of the spine. Oops, sorry, this is going crazy. Don't do that. Okay, and the rib cage is all part of the axial skeleton, the spine down to including the sacrum and coccyx. That's the axial skeleton. The appendicular skeleton is the girdles. So the shoulder girdle, of course, is the scapula and clavicle. We're going to come back to the axial skeleton. That's why I just flew through it quickly. Scapula and shoulder girdle, and clavicle, those are the shoulder girdle muscles. And then the upper extremity. The upper extremity, we'll revisit it in a minute here. And then we also have the pelvic girdle, which is the coxal bone, which is those three bones, plus the lower extremity. All the way down to the foot is that's the appendicular skeleton. Okay, so the shoulder girdle and upper extremity, the pelvic girdle and lower extremity make up the appendicular skeleton. So let's go back to the axial skeleton, starting with the head. So if I were to ask you how many bones make up the cranium, well, we'd need to know, are we talking about the neurocranium, or what part of the cranium are we talking about? But let's just say, let's start with the part of the head that protects the brain. How many bones make that up? You guys remember these bones, right? So we have the frontal bone, that's 1. We have the sphenoid bone, that's 2. We have 2 temporal bones, so that's 3, 4. 2 parietal bones, that's 5, 6. We have, we have an occipital bone, that is 7, and I don't know that we can get to it. The ethmoid bone is the other one. That's 8. Those are the bones of the cranium. Those are the cranial bones. Now the facial, so that was 8 cranial bones. Facial bones, however, are not the cranial bones. So the facial bones are the ones that house the organs of, the sense organs. So the maxilla, the mandible, I'm getting ahead of myself. The mandible, that's 1. The maxilla, 2, 3, because we have 2 maxilla, a right and a left. A zygomatic bone, that is 4, 5. What else? Let's see, 4, 5. We have, there's the ethmoid bone. We can't indicate it there. Sorry, so ethmoid bone, you remember, that was part of the cranium, the 8 bones of the cranium. Okay, where were we? Sorry. We had the mandible, the zygomatic bone, the maxilla. That's 1, 2, 3, 4, 5 bones so far. 6, 7, if we count the 2 nasal bones. Vomer makes 8. The inferior nasal concha make 9, 10. Well, the lacrimals make 11, 12. And then the palatine bones, right there, palatine bones, right and left, make 13, 14. So 14 bones, 14 facial bones, 8 cranial bones. Okay, so I'm not going to go through all of the landmarks that we talked about on this video because it would make it too long, but please do review the landmarks of the skull, especially the palpable landmarks or the landmarks that have to do with articulations. Okay, so that is the skull. The spine, also part of the axial skeleton. So we know that we have 7 bones, 7 cervical vertebrae. The atlas and axis are both pretty special. They're shaped unlike any other bone. There's the axis with its dens sticking up, and the atlas. This is the atlas with no body, no spinous process. Big condyles for the, or big facets, I should say, for the occipital condyles. Okay, that's atlas and axis, and then that's C1 and 2, 3, 4, 5, 6, 7. 7 cervical vertebrae. You knew that. And how many thoracic vertebrae? 12. 1, 2, it's hard to indicate these because they show up right, the thing shows up in front. 3, 4, 5, 6, 7, 8, 9, 10, 11, whoops, 12. I just put on cartilage without meaning to. Okay, 12 thoracic vertebra, and then lumbars. There are 5 lumbar vertebrae. You know that, right? 1, 2, 3, 4, 5 lumbar vertebra. So do you know those parts of the vertebra, like the spinous process, the transverse process, the superior articular process, the inferior articular process, the intervertebral foramen, the intervertebral discs, which just went away when I took the cartilage off, the connective tissue off. There are the discs you can see in there. And okay, so we have 7, we have 12, we have 5. Onto the sacrum, there is 1 sacrum that's made from 5 fused bones, and then we have 1 coccyx that's made from 2 to 4 fused bones. But the numbers for the sacrum and for the coccyx are 1. 1 coccyx, 1 sacrum. Okay, that is the axial skeleton. Appendicular skeleton. The shoulder girdle is the scapula, and to review all of those landmarks, like the medial border, the lateral border, the superior angle, the inferior angle, the spine, the superior border too, the acromion process, the coracoid process, the glenoid fossa, the subscapular fossa, the supraspinous fossa, infraspinous fossa, all of those guys. So the scapula along with the clavicle make up the shoulder girdle. The upper extremity, however, is not the shoulder girdle. So the shoulder girdle is part of the appendicular skeleton, but the upper extremity is the humerus, the radius, the ulna, the 8 carpal bones. I'm just indicating one of them there. So there's 8 carpal bones. So where are we at? 8, 9, 10, 11 bones so far. 11, and then if we add 12, 13, 14, 15, 16 bones, that gets us through the metatarsals, or metacarpals, sorry, that was 16, and then 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, oops, sorry, 27, 28, 29, and 30. Okay, so when we count the number of bones of the upper extremity, there are 30 bones in one upper extremity. We can see right here, we didn't talk about these when we talked about the hand, but we did when we talked about the foot. We can see the sesamoid bones, but on the hand, on the upper extremity and lower extremity, we do not count those for whatever reason. So there are 30 bones of the upper extremity. So we don't count the shoulder girdle, just the upper extremity. So if I were to ask how many bones are in the upper extremities, both of them, the right and left upper extremities together, the answer would be 60 bones. If I asked how many bones are in just the right upper extremity, the answer would be 30 bones. Or if I asked how many bones are in the upper extremity plus the shoulder girdle, then it would be 32 bones. I forgot some of the axial skeleton is the rib cage. Dear me, let's not forget the rib cage. So the rib cage is made up of the sternum. So we're backtracking. That's okay. It's all so clear in your mind, I'm sure. There are 3 parts to the sternum: manubrium, body, xiphoid process, but the sternum is one bone. The ribs, how many ribs do we have? We all know that. There are 12 sets of ribs. 7 of those, the first 7, whatever, I'm not going to count them, 1 through, where are we at? Oh, that's 8. 1 through 7 are the true ribs. If we put on cartilage, maybe we can see why they're called true ribs. Where'd the cartilage go? There it is. So 7 true ribs, and then 5 false ribs. So, there's nothing terribly false about the rest of the ribs, but 8, 9, and 10, and 11 and 12 are all false ribs. But 11 and 12 are also referred to as floating ribs because they do not tie into the costal cartilage here. Whereas 8, 9, and 10 do tie into the costal cartilage, but all of their cartilage ties into the cartilage of I didn't mean a pin, I meant a pen, into the cartilage of rib 7 right here. So anyway, so 7 true ribs, 5 pairs of false ribs. 2 of those 5 pairs of false ribs are floating ribs. That's 11 and 12. Okay, that was a backtrack to the axial skeleton. Back to the appendicular skeleton. Lower extremity. So the lower extremity, so we have, of course, the pelvic girdle, which is different than the pelvis. Remember, the pelvis is the right and left coxal bone. So a coxal bone is the ilium, the ischium, and the pubis. Those 3 bones together make up one coxal bone. If we add the right and left coxal bones together with the sacrum and the coccyx, we get the pelvis. If we're just talking about the coxal bones, then we're talking about the pelvic girdle. Okay? So pelvic girdle plus sacrum and coccyx, that's the pelvis. Just the coxal bones, that's the pelvic girdle. How many bones are in the lower extremity? 1, the femur. Now in the lower extremity, we do count that patella. I didn't make up these rules. I'm sorry, guys. That's just how it is. So 1 femur, 2 tibia, 3 fibula, 4 patella. Okay, that's 4 bones there. How many tarsals do we have? Anybody remember? I know you all do. 7 tarsal bones. So, oh gosh, what does that put us at? 7, 8, 9, 10, 11. And so from there, actually, and then the feet are exactly like the hands, other than, once we're past the tarsal bones, it's exactly like the hands. So the lower extremities also have 30 bones. So it's pretty easy to remember because in the lower extremity, there are 7 tarsals, whereas in the upper extremity, there are 8 carpals. But in the lower extremity, we count the patella. And in the upper extremity, there's no equivalent of the patella at the elbow. And so it comes out to the same number of bones. So there are 30 bones in the lower extremity, 30 bones in the upper extremity. So that's just the extremity, though, not including the girdle. Okie dokie. And then remember the major landmarks on those bones, especially the landmarks. And again, I'm not going to go through all of them, but the landmarks that are palpable and the landmarks that are that make up articulations. Okay, all right, so that's it for our skeleton review. Let's go on to our muscle review. So review the diagrams that I posted for the midterm review. So all of those upper body muscle diagrams. So there's like muscles of the back. There's a diagram of that. You know, so diagrams that have these, all of these muscles, be able to label all these guys. So we remember all these guys are good friends. This is way back in the beginning. Latissimus dorsi, rhomboids, levator scapula, the rotator cuff muscles, infraspinatus, supraspinatus, teres minor, subscapularis, pec minor. What else do we have in through here? Oh, pec major, right here. If we put more on, we have the most superficial muscle, trapezius, most superficial muscle of the upper back. If we take some off, we find the erectors in through here. All of these guys are erectors. We have serratus posterior inferior, serratus posterior superior. Let's not forget serratus anterior. Also, oops, that's iliocostalis. Let's take some off here. Also, quadratus lumborum. We're on to the front, psoas. And the diaphragm, the intercostal muscles. Remember, we have internal and external intercostal muscles. Okay, and then other trunk muscles, we have the abdominal. So transversus abdominis, this is rectus abdominis that just showed up here. The internal intercostals, the external intercostals. That's the trunk. And then, but let's not forget the neck. We have sternocleidomastoid. We have, as a group, we have the infrahyoids down in through here. Those are all infrahyoids. We have suprahyoids up in through here. Oops. Those guys are suprahyoids. And then, so those are two groups. And then we have the scalenes, important group here. Okay. So what else? Oh, and then other neck muscles back here. We have splenius capitis and splenius. Oops. Sorry, there's splenius capitis. That was also splenius capitis. And oh dear. Well, splenius cervicis. There he is. Splenius cervicis. Okay. Muscles of the face. Oh my gosh. Remember those guys? Orbicularis oris, nasalis, mentalis, levator anguli oris, occipitofrontalis. This is the back of it. This is the occipitalis part of occipitofrontalis and the frontalis part of occipitofrontalis. Oh, I already said levator anguli oris. What else? We'll come back to the muscles of mastication in a minute. Depressor supercilii. What else? Levator labii superioris, zygomaticus major, zygomaticus minor, depressor labii inferioris, orbicularis oculi, procerus. We already did nasalis. What else? We already did that. Let's see. Did we do that? Depressor labii inferioris. Oh, we didn't do this one. Depressor anguli oris, platysma. We did not do buccinator. Where's that guy in there? Okay, that's buccinator. Oh, and rhizorius. Let's not forget our laughing muscle, rhizorius. Okay, those were muscles of facial expression, muscles of mastication. Am I really covering all the muscles we talked about? This seems ridiculous, doesn't it? Masseter. Masseter is prime mover in elevation of the jaw, elevation of the mandible. Temporalis. Those are two major muscles of mastication. And then inside, much harder to get to on the app, we have the medial pterygoids and lateral pterygoids. Wow, I got one. Okay, let's fade everybody. There's medial pterygoids, and then we have lateral pterygoids in there too. Okay, what else? Okay, upper extremity muscles. Biceps brachii, those were the 2 heads of it. Triceps brachii, 1, 2, 3 heads of it. And deep to biceps brachii. Oh, we lost everything. Is brachialis, it's right there. If we fade everybody, we can see him. What else? Coracobrachialis. I think it's right in there. Coracobrachialis, and what else? And then, so that's upper arm, but let's add some on here. We have deltoid. We have pectoralis major. Let's move down the arm. We have brachioradialis. We have, then basically, let's see, we get into the flexors and extensors of the forearm. So the superficial ones, flexor carpi ulnaris, extensor, oh, that was flexor carpi ulnaris. We usually look at that one from this side. So flexor carpi ulnaris. Let's look at the extensors though. Extensor carpi ulnaris, extensor digitorum, extensor carpi radialis longus, extensor carpi radialis brevis, superficial ones here. In here we have pronator teres that pronates the forearm. We have flexor carpi radialis. We have palmaris longus. We already looked at this one, flexor carpi ulnaris. I'm not going to ask you intrinsic muscles of the hand, and I don't think I'm going to ask you deep muscles of the forearm. Oh, anconius. Let's go back. Do we see anconius here? Where are you, anconius? Oh, gosh darn it. Oops. No, that's supinator. Okay, well, you remember anconius, right? Anconius helps triceps brachii extend the elbow. But this is supinator. This is pronator quadratus. We already saw pronator teres. Okay, let's move on. What else? Oh, let's see. When I was going through the trunk muscles, I indicated psoas major, but don't forget iliacus also. Let's see. Adductors as a group. Here we go. Adductor. So this is pectineus, adductor brevis, adductor longus, gracilis, adductor magnus. Those are the adductors. Let's look at, we can see some deep lateral rotators in through here. All of these guys are deep lateral rotators of the hip. Let's add on, here's piriformis, a pretty important deep lateral rotator. A lot of what's important about it is its juxtaposition with the sciatic nerve, which is right here. We also have, oops, okay, we have gluteus minimus, gluteus medius, gluteus maximus, tensor fasciae lata, sartorius. Okay, we need to be able to label all of these muscles for sure. Let's look at the quads while we're here. Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. Those are the quads. Let's look at the hamstrings. So hamstrings, we have biceps femoris, we have semitendinosus, semimembranosus. Remember the muscles that make up the pezanserine tendon are semitendinosus, gracilis, and sartorius. Those three make up the pezanserine tendon, which is right down there. All right, on to the lower leg. So we have gastrocnemius, the two heads of gastrocnemius. We have soleus. We have some deeper muscles in through here like plantaris and popliteus. Some lateral leg muscles. We have We have fibularis longus, we have fibularis brevis, we have fibularis tertius. Those are the three of the lateral leg. Anterior leg, we have tibialis anterior. Remember, tibialis anterior and peroneus longus make up the stirrup of the foot because they attach to the same place underneath the foot, but they go on either side of the foot to get there. What else? And then deeper muscles in through here, we have extensor hallucis longus, we have extensor digitorum longus, we have flexor digitorum longus, and flexor hallucis longus, and let's not forget tibialis posterior. I'm not going to ask you deep muscles or intrinsic muscles of the foot. Okay, did I leave it? And I'm not going to ask you pelvic floor muscles. So I might ask you to label facial muscles. I might ask you to label any of the muscles I just zoomed through. Okay, let's see, what else do we need to know about for the final? We need to know certain things like where certain muscle groups attach, especially like major muscle groups. For instance, like quadriceps, the quadriceps femoris group, that they share a common distal attachment here at the tibial tuberosity, and they share an action, the action of knee extension. So as a group, the quads extend the knee. As a group, the hamstrings flex the knee. Let's see, what other stuff do we need to know? We've just gone through all these lower body muscles, but also don't forget your upper body muscles. So like, for instance, remember that latissimus dorsi, latissimus dorsi and teres major extend and adduct the arm at the shoulder. Latissimus dorsi is prime mover in shoulder extension. So that's latissimus dorsi, prime mover in shoulder extension. While we're at it, gluteus maximus, prime mover in hip extension. What's the prime mover in hip flexion? Right here, psoas, prime mover in hip flexion. What else? Let's see, what other prime movers do you guys need to know? Let me see. Let's see, hip flexion, shoulder abduction, prime mover. What would the prime mover in shoulder abduction be? You're right, it's the deltoid. Knee extension as a group, we'd have to say it's the quadriceps group. Elbow flexion, prime mover, we pretty much, well, it depends on the movement really, but officially, we kind of want to say biceps brachii, right? But officially, brachialis is the prime mover. It's stronger in elbow flexion, mostly because it only crosses the elbow, and so that's the only joint that it moves, and the only thing that it does is elbow flexion, whereas biceps brachii crosses the shoulder and the elbow, and so it flexes the shoulder and it flexes the elbow and it supinates the forearm, so it has 3 movements that it does, whereas brachialis just has 1. So it's really the one that's actually considered prime mover. Oh, did I say brachioradialis? I think I did when we were talking about, anyway. What else here? Okay, so how about elbow extension? Prime mover and elbow extension, that's pretty simple. That's triceps brachii. Flexion of the cervical spine. What do you think would be prime mover and flexion of the cervical spine? It would be, let's take off this, the most superficial. Here we go. Prime mover in flexion of the cervical spine is sternocleidomastoid. How about elevation? Oh, I already mentioned it. Elevation of the mandible is masseter, is the prime mover, is the strongest. Masseter is temporalis, is stronger, works really well at doing a moving elevation, whereas masseter does it like a clenching elevation, like it holds the mouth shut, it clenches the teeth, but it is a stronger muscle, so it's considered prime mover. Shoulder extension, we talked about that one, is latissimus dorsi. Protraction of the scapula, prime mover and protraction of the scapula, serratus anterior. Knee flexion as a group, we'd have to say hamstrings or prime mover there. Compression of the abdomen, prime mover in compression of the abdomen. Yes, you got it. Transversus abdominis. Let's see, what other things do we need to review here? So know your antagonists also. So like, so for instance, like the adductors, we know what actions the adductors do, right? Their name tells us that they do adduction. What muscles are the antagonists of the adductors? So the adductors do adduction. What muscles do abduction of the hip? Gluteus medius and gluteus maximus. They would be the antagonists there. Let's see. What about an antagonist to soleus in plantar flexion? Okay, so soleus does plantar flexion. What muscle? So what's the opposite action of plantar flexion? It's dorsiflexion. What muscle does dorsiflexion? Tibialis anterior. Let's see. Biceps brachii, triceps brachii. Those two are antagonists to each other in elbow flexion and elbow extension. Let's see what else. Labeling, I'm just kind of zooming. I'm looking at the exam as I speak, and I'm trying to see if there's anything else I need to tell you that you need to know. I think we covered it. So, okay, let's call it done, this review for this final exam. So be sure you can label all of these guys, okay? Labeling of bones and muscles, but also know these movements of the muscles. And if you know the movements of the muscles, if you know where the muscles are and you have a good sense of where they attach, you should be able to figure out the movements. If you know the movements, you can also figure out the opposite movements. And so then you can figure out which muscles are synergists to each other, which muscles are antagonists to each other. Actually, let's just run through lower body synergistic groups in our lower body actions, because we didn't talk about that. We did in class the other day, but we didn't thoroughly talk about it. So let's start with hip extension. What are the muscles that do hip extension? Gluteus medius, that's gluteus maximus. Gluteus maximus does hip extension. Posterior fibers of gluteus medius do hip extension. Posterior fibers of gluteus minimus do hip extension. And who else does hip extension? The hamstrings. The hamstring group does hip extension. Opposite action of hip extension is hip flexion. Prime movers in flexion. Prime mover is psoas, unless we're counting iliacus and psoas together as a muscle, and then because they come together here and share a common distal attachment at the lesser trochanter, then we could say iliopsoas is the prime mover in hip flexion. And so psoas and iliacus both do hip flexion. All of the adductors do hip flexion. Adductor longus, adductor brevis, pectineus and gracilis. And even adductor magnus, I'm trying to add on gracilis here, there's gracilis. Even adductor magnus does some hip flexion, but it is so posterior, actually I should have included it when we were talking about hip extension. Adductor magnus does hip extension. But the rest of the adductors do hip flexion, so as an iliacus do hip flexion. The anterior fibers of medius and minimus do hip flexion, so gluteus minimus, gluteus medius, anterior fibers do hip flexion. Rectus femoris does hip flexion, sartorius does hip flexion, and tensor fasciae lata does hip flexion. Lots of muscles doing hip flexion, countered by very strong muscles that do hip extension. Hip adduction is done by the adductors, so pectineus, adductor longus, adductor brevis, gracilis, and adductor magnus. They do hip adduction. Hip abduction is done by tensor fasciae lata, which we see indicated here, gluteus medius, gluteus minimus, and gluteus maximus all do hip abduction. Remember, gluteus maximus also actually does hip adduction as well. Okay, let's see. Let's move down to the knee. So knee flexion is done by the hamstrings. Knee extension is done by the quads. And there is some medial and lateral rotation that happens at the knee when it is bent also. And so muscles that attach on the medial side do medial knee rotation. Muscles that attach on the lateral side do lateral knee rotation. And then also knee flexion is gastrocnemius, although more strongly gastrocnemius and soleus do plantar flexion. And tibialis posterior also does plantar flexion. And like these guys, the extensor digitorum longus and extensor hallucis longus also do plantar flexion, but they do more toe stuff. Anyway, plantar flexion as a group, those are muscles that do that. So to counter that, dorsiflexion is done by tibialis anterior. It's also done by fibularis tertius. Fibularis longus and brevis also do plantar flexion. They go in the plantar flexion group. Fibularis tertius, though, does dorsiflexion, as does tibialis anterior, as does extensor digitorum longus and extensor hallucis longus. They all do dorsiflexion. Let's see. Inversion is tibialis anterior. That's kind of our main guy doing inversion. Eversion, we have fibularis longus and fibularis brevis doing eversion. And others. There are deeper ones, but those are the main ones to know for inversion and eversion. Okay, and then we're into like toe stuff, and those muscles, the names all tell us what they do, whether they flex or extend or adduct or abduct the toes. Okay, have I left anything out? Let's say I haven't left anything out. Let's say you guys are totally ready for the final. Let's say that you are in appreciation of the huge amount of knowledge that you have mastered this quarter in anatomy. And let's say that you're so proud of yourselves, as I am proud of you for doing so. So I hope you've had a great quarter. I hope that you've learned a lot. And I hope that you keep using the app and keep looking up stuff in anatomy as things come up, and continue to deepen and integrate your anatomical knowledge. Okay, so here we are signing off of video 25, review for the final exam.